Hey everyone, when your kid gets sick, it's just plain stressful, right? But with everything going around, there's one question that can cause a whole lot of anxiety. Is this just a regular cold, or could it be something more serious, like influenza A? Well, today we're going to clear all that up.
And yeah, it's that moment every parent just dreads. The fever, the cough, the runny nose, they all look so similar at first, and that worry can really start to build. But knowing how to tell the difference, that's not just about getting some peace of mind, it's about knowing exactly when you need to take action.
And look, this isn't just some what if scenario. We're seeing more and more outbreaks of influenza A, which means the chances of our kids coming into contact with it are just higher. So being prepared is absolutely crucial. Okay, let's dive right in. So, first things first, let's get right to the root of it all. Because even though a cold and the flu can feel really similar, they are caused by completely different viruses. And that's really where the whole story begins.
Think of the common cold as, well, kind of like a free-for-all. It can be caused by more than 200 different viruses out there. That's why it feels like our kids are catching them all the time. The good news, though, is that they're almost always mild, and they usually clear up on their own without any serious problems.
Now, influenza A, that's a whole different beast. It's caused by very specific strains. You've probably heard of them, like H1N1 or H5N1. And this is the type of virus that's been responsible for major global pandemics throughout history. So yeah, it has the potential to cause really serious complications, like pneumonia. It's not in the same league as the common cold. Okay, so we know the viruses are totally different, but what does that actually look like when your kid is sick? Let's get into the symptom showdown, because this is where you can really start to see the difference. You've got the runny nose, the cough, they're feeling wiped out. It all just kind of blends together, right? But listen, there's one clue, one really crucial clue that experts say is often the most reliable sign right at the beginning.
And wow, this chart just lays it all out, doesn't it? Take a look at that top line, fever. With a cold, your child might have a mild fever or maybe none at all. But influenza A, it often hits like a freight train with a high, persistent fever. We're talking over 38.5 Celsius, that's about 101.3 Fahrenheit. And check out the onset. A cold just kind of creeps up on you over a few days. The flu feels like it hits you out of absolutely nowhere. Sudden, intense exhaustion, body aches, the whole thing. That high fever, that's your number one clue.
And knowing the difference here, it's not just for your own peace of mind. For certain people, getting influenza A can be way, way more dangerous. And these are the folks we really need to worry about. Little kids under 5, because their immune systems are still getting up to speed. Pregnant women, older adults, and really anyone who's dealing with a chronic health condition or has a weakened immune system. For these groups, the flu is absolutely not a wait-and-see kind of thing. Which brings us to, honestly, the most important part of this whole discussion. So forget the guesswork. This is it. This is your clear, actionable checklist for when you absolutely have to get medical help. So please, really tune in for this next part. If you see even one of the signs we're about to go over, that is your signal. It means it's time to call the doctor or head to urgent care right away. It comes down to 6. 6 critical red flags that every single parent needs to have burned into their memory. These are the signs that mean you stop waiting and you start acting. Let's go through them. Okay, let's break them down. Number 1, lethargy. And we're not just talking sleepy. This is extreme drowsiness where it's actually hard to wake your child up. 2, they're refusing to eat or drink, like way less than they normally would. 3, they're vomiting everything and can't keep anything down. That's a huge risk for dehydration. 4, that high fever just won't break even after you've given them medicine. 5, this one is an emergency, any kind of seizure or convulsion with a fever. And number 6, their breathing is really fast or it looks like they're struggling to get air. Just remember, even one of these is enough. It's time to make the call. Okay, so we know how to spot it, we know when to call the doctor. Now, how do we stop it from happening in the first place? Let's talk about being proactive. This quote just hits the nail on the head, right? An ounce of prevention is worth a pound of cure. And that has never been more true than when we're talking about a virus like influenza A. So what's in our prevention toolkit? Well, number 1, top of the list, without a doubt, the annual flu vaccine. Experts all agree it's the single best thing you can do for anyone 6 months and older. And after that, it's all about those good habits we know so well. Washing hands like it's your job, trying to keep little hands away from faces, covering coughs and sneezes, and of course, keeping your kid home when they're sick to help protect everyone else. So there you have it.
You've got the tools, you know the key differences to look for, you know the serious red flags that mean it's time to act, and you know the best ways to keep your family safe. The power to act with confidence is officially in your hands. Thanks so much for joining us.